You want to do the intro?
Not really.
You're going to do the intro. And you're going to like it.
Does that count?
No. Do it.
Redx wants me to do the intro this time, so, hi.
I'll give it an almanac out of 10.
All right. That's what I was going for.
All right, so welcome back to Let's Play Trauma Team. I'm redxparasite.
I'm Air327.
You can't find either of us in an almanac because we're not nearly
We're not that
influential enough.
Yeah.
Anyways,
I mean,
this episode,
the word error is probably in there somewhere. Because it's a common word.
So is
the word
parasite.
red probably is.
Yeah. The letter X is probably in there.
I would assume so. Be impressive to write an almanac without using it. And probably exclude a lot of information. Just the word exclude.
Yeah. All right.
We're just getting onto stupid tangents to start this before things get any stupider.
I think we should diagnose our ability to get off topic.
Diagnosis, very good.
It's looking like a very strong case. And yes, the scene is overlapping from orthopedics.
Hey, Hank.
It's kind of cool that they do that from time to time.
So you're the one who takes care of the flowers?
It makes it feel less like
Well, I'll be.
playing 6 separate
I enjoy
stories.
It also makes
With
more
love,
sense if you're
and
just
they
playing
blossom.
through the stories, like doing all of the missions of
So
one type in
different
a
from
row.
humans.
Mm-hmm.
So you're
So,
not as
what'd
left
you need
out.
me for?
Yeah.
Moving heart.
Hmm.
Could you take a look? This condition is a strange one.
Is their heart moving?
So, what's with all the fuss today?
Well, you haven't heard? Someone's doing an OLCVR today.
You're kidding, right? No one does that procedure anymore.
I wish I knew what that was.
What letters
I'll be
was that?
assisting. A specialist's
OLCVR.
coming in for it.
All right.
It's one of your patients, you know.
Mine? Don't tell me. Hey, out of the way! Let me through!
It's all right, man. I thought you'd come.
I guess it has to do something with his
So,
dilated
It is
cardiomyopathy.
you! An OLCVR? What are you thinking?
You told me yourself that you're the doctor, right?
Yeah, I may have said something along those lines. So?
Well, you're
Overlapping
the doctor.
cardiac volume
I'm the
reduction
politician.
operation.
Okay, that makes sense actually.
Yeah, well, it's my duty to
Overlapping
lead this country,
cardiac
even if my
volume
life's at
reduction.
risk.
Operation.
Okay.
But
Do you
yeah.
have
actually,
any
operation
idea
functions.
what kind of
Operations is
operation
part of
this
the
is?
acronym.
It's outdated and it won't cure you. It's just a stall.
You afraid?
I mean, a stall is better than nothing.
You were so strong
guess.
before, preaching at me.
Well, I mean, what he really needs is a transplant.
But son, you
Yeah.
don't get to my age being as timid as you are. One thing I've learned over the years, never give up.
I mean, it might help in the short term, but it's not
Mhm.
gonna just fix things in the long run.
That's one determined
Right.
old fool.
And of course, there are potential complications.
But yeah, the first result is what looks like a
Let's
paper
begin
from
today's diagnosis.
2005.
Huh. Well, and this game came out in 2011, so yeah.
Well,
The patient,
we taught you
Shelley
something.
Brooks, claims to
Wasn't
have a
much, but
fever.
congratulations.
The game will probably teach you more than we will.
Oh yeah, probably.
All right, Shelley Brooks.
Dr. Cunningham, are you listening?
Stockbroker previously treated for chronic renal failure. She was admitted for having an unusually long cold.
Yeah.
Renal is kidneys, right? Or liver? think it's kidneys.
Kidneys, I think.
Yeah.
You may overlook something critical.
Huh? What are you talking talking about. It's not gonna happen.
Your concentration is low.
Does Assistant Secretary Tillman's operation weigh heavily on your mind?
Shut up. It's not it.
I'm pretty sure that's probably it.
I'm sorry,
Yeah.
but if you are troubled, I am equipped to listen.
They even gave you a consultation function, huh?
No, but I can supply template responses to match.
That's just pity comfort. Come on, let's start the diagnosis.
Understood, Doctor. I am now opening the patient's chart.
Your mind is the ultimate tool. Just have fun reading those taglines.
Yeah. See, I'm never paying enough attention
Hello.
to
Glad
notice
that
those
someone can
myself,
see
and
me.
it just comes out of nowhere every time you say it for some
Oh, yeah.
reason. Yeah.
So hopefully she'll be more cooperative than Tillman was.
Not a problem.
I think it would be pretty
Now, to
difficult
begin with.
not to be more cooperative than him.
I'm sorry, Doctor, but I have to attend an important business deal soon.
You might be wrong.
God damn it.
Is it possible to keep this as quick as you can, please?
Well, I wasn't planning on wasting time. Roni, are you ready?
Yes, Doctor.
All right, let's start the diagnosis.
All right. We've seen this before. We know what to do.
I think it's just a cold. Can you prescribe me something so I can get back to work?
That's not how things work.
You can't? Oh dear. This isn't good. I've got a meeting soon. I've had a fever.
All right. Yeah, that's definitely something.
Continuous fever, huh? Excuse me, but are you married?
Doctor, is that relevant to my illness?
Well, there's no direct relevance. A
Okay.
woman's body temperature increases
Oh.
during pregnancy. We see a lot of women who think it's a fever.
I doubt it's that.
Oh! Well, thank you for thinking about that. Nope, you don't have to worry about that. I'm totally concentrating on my job now.
I see. Then let's make a note of
Okay,
this,
then.
Roni.
Understood, Doctor. New symptom observed. Fever.
Why is that effect so satisfying?
I've also lost some weight, but
Have you seen that one
Oh,
video, like the
weight
most
loss.
Yeah. Have you seen that one video, the most satisfying video in the world?
I don't think so.
Okay, I'll have to show you that.
Weight
Okay.
loss. Whether this is a symptom or not depends on how much you lost. So, what was your original weight and what is it now?
I don't really want to mention how much.
I'm your doctor, tell me.
Okay. You don't have to be specific. Ballpark it.
Well, it seems like a lot. Like it's more than should be natural.
I see. I appreciate your
All
cooperation.
right, well, that's good enough.
Jot
Yeah.
that down.
Understood, Doctor. New symptom observed. Weight loss.
Besides that, I've been having night sweats, but that might be the fever too.
Separate symptom, or?
Can't think of anything other than
Can't
those.
hurt to have him look at it, right?
Well, actually, it can. If,
Can't hurt
if you
too much.
if you misdiagnose something, then you will get like a strike on your
Oh, yeah.
thing.
I think it could
Night
be.
sweats, huh? Dysautonomia is the first thing that comes to
Dysautonomia.
mind, but you've been busy with work, right? Does it stress you out?
Stress? That's a good one, Doctor. I love my job.
You're a strange one. If I had my pick, I'd be sitting on my couch all day.
That is not relevant, Doctor. Observe.
I thought you weren't planning on wasting any time.
Sheesh, enough already.
Oh, I wasn't trying to hide this or anything, but I had an operation 2 months ago. It wasn't at this hospital. I had some kidney trouble and received a transplant.
Does that count as a symptom?
There's some
Not
odd
really. Oh,
bruises around the...
okay, that's something.
Bruises. Around the operation scar? That worries me a little. Could you tell me in detail where they are and what they look like?
Oh, yes, of course. The scar from the transplant healed cleanly, so there isn't much of it left. But there are these black bruise-like things around where it was.
I'll need to look at it in detail. Would you mind showing me later?
Yes, if you need to see it for the examination, I understand.
Okay.
It's strange. I made sure to take the medication they gave me, too. But that's it, really. See? It's just a cold, right?
I think it's more than just a cold, but
I mean, it ended up in this game.
Abnormalities around the operation.
yeah.
Yeah.
Aside from the fact that we know there's going to be something more
Yeah.
play.
It would be funny if for one of these, the diagnosis is just, Yeah, you've just got a cold. Just wait a few days.
It's true there are dark red pigment spots around the operation scar. Did these exist before the kidney transplant?
No, I'm sure of it. I'd have noticed if those were there before.
Did you show these to your doctor? Or what did he say about them?
This is the first time I've seen a doctor since the operation. I've been so busy at work that I couldn't keep any appointments.
I see. Then this needs to be
What was
examined.
that about not being stressed? Also, the
I'll
arrow
need a scintigraphy
again.
and a biopsy done.
Understood, Doctor. Since biopsies are done in the pathology department, it will take some time. Is this acceptable?
If it's not in our department, I can't tell them to do it right away. Just let me know when the results come back, Roni.
Understood, Doctor.
Means
So
we'll
it'll
probably
become-
have to do some things before.
Yeah, it'll become relevant
Also,
later, in
the
other words.
scintigraphy is ready.
Oh, apparently it's ready. The scintigraphy is ready. Okay. Anything else on the visual exam that you can see? I don't see anything readily apparent.
Yeah, not really.
Okay, nothing with her heart. Looks like your breathing's fine too.
Mm-hmm.
Yeah. All right, nothing with the stethoscope. So we'll probably have to look at the exams. We didn't get a diagnostic yet.
I know.
Oh, what?
A diagnostic, like the ranges,
Oh,
things like
yeah.
blood tests, and
Right.
thallium uptake. Looks like on the right side.
Well, it does.
Oh,
That
wait.
just says
Oh, okay. Patient's image, normal image. Huh. Do you see anything?
no.
Yeah, I'm not seeing anything that looks.
Or wait, below on the left one, on the left side of it, below the two blue dots.
Oh, yeah. Like
That's-
right there?
Yeah. Wait, didn't we determined I could point? Why am I not pointing at it? I'm an idiot.
The uptake of thallium matches
Oh,
the
yeah,
pigment
because you
spots
remember
on the skin.
spots around her scar.
Oh yeah.
There's a good chance the pigment spots are tumors. We should review our diagnosis candidates.
All right.
Understood, Doctor. New symptom observed.
So now time to go and look at candidates. I don't know if we can find anything else at the moment. Or the game at least won't give us anything else right now.
Yeah.
All right, time to read. Inflammations occur along with several patches of
Oval-shaped
red pigment spots.
Okay, yeah, that's
Appear with the inflammation, often such as lack of appetite,
Ma-
fever, and joint pain. So that's all we have on that one.
Yeah, I mean, lack of appetite is similar to weight loss, but not the same thing, I don't think.
Malignant tumor that forms on skin cells that create melanin, pigment spots with tumors.
So the pigment spots.
That'd be way too easy though.
Yeah, only two.
All right. Erythema multiforme. Skin disease caused by viruses. Outbreak is
Both
accompanied by
sides.
symmetrical pigment spots
On
on
both
both sides of
sides.
the body, which is not. All right, there is fever, headache, and joint pain. Antibodies is present in the blood analysis. Kaposi's sarcoma, a type of malignant skin tumor caused by human herpes virus 8. Patient exhibits
Fever, weight
symptoms
loss,
like
night sweats,
fever,
and pigment
oh, wait.
spots.
Pigment spots, scintigraphy. You will find abnormal uptake in areas with heavy
Yeah.
pigmentation.
Kaposi sarcoma? All our symptoms apply to it, but
Doctor, are you concerned about something?
This might be a like a double
Oh,
one
a
as well.
two-stage thing.
There's no way Kaposi sarcoma occurs unless there was an extreme decrease.
Yeah,
in the
so like we
immune
might
system.
have to figure out the cause.
If we don't solve that portion, it's impossible to make a diagnosis. I feel like it's right there in front of me.
I'm guessing it has something to
do
do
you
with liver
remember anything that might help?
Was it liver transplant?
She had an operation. I don't know.
It was a something
kid-
transplant.
Yeah.
Negative, Doctor. I record only pertinent facts in my memory.
Thanks,
Would
Roni.
you like to change these settings so that I record every detail of the diagnosis?
No, let's not. I feel like I'd be cutting off all my escape routes. Oh well. I think it's time to listen to what the patient has to say again.
All right, and I don't think it's the flu.
Yeah.
Muscle pain, weight loss, night sweats. Yeah. So looking likely for Kaposi sarcoma. It's a really interesting name.
Yeah.
Sorry to keep you waiting when you're so busy. How are you feeling?
Nothing much has changed in particular. Is this gonna take long?
Well, it depends on how well you work with me.
Don't get so hasty. It's going to take a little more time until you're diagnosed.
I see. I've got a meeting soon, though.
Guess what? You have a meeting right now.
I think it's just a cold. Can you
Oh,
prescribe?
is this not new?
No, it wanted us to listen to it. Get to where she talks about the transplant.
Oh, okay.
I think it was at the very
I've also
end.
lost. Besides that, I can't.
Because she talked about,
but
yeah,
I
I
had an
wasn't trying
operation
to
2
hide
months.
it.
Well, let's see.
I had some kidney trouble and received a
Yeah.
transplant.
Oops.
That wasn't it.
So that's what happens. Oh,
Oh, and it's a full one.
There's some odd bruises around the. It's strange. I mean,
It might be the.
but that's it, really. See,
severely inhibited immune system. Oh, maybe we just had to listen to it again.
Oh, specific medications with immunity. So press about
Oh.
the one that talked about taking the medication.
Oh yeah, I took the medication that day. Yeah.
Yeah. So we were on the right track.
Oh,
Yeah.
But the
I
wrong
had some
one.
kidney- There's some odd. It's strange.
There we go.
Oh, yeah. The medication prescribed after the kidney transplant.
No, I mean hopefully we won't mess up.
Yeah, I don't think
too
we'll
much.
I don't think it'll be a problem.
Hey, I'm sorry, but can I confirm something? You were given immunosuppressive drugs, right?
Yes. Isn't that something normal to take after an organ transplant?
Yeah, that's right. But that's something we need to know in making a diagnosis. Now, everything depends on the results of your biopsy.
All right.
Dr. Cunningham, the biopsy results have come back from the pathology
Hey.
department.
Finally.
The antibody reaction was positive, but they failed to specify the virus causing the disease.
Failed to specify the virus? What in the world are they doing?
The reason is unknown, Doctor. Shall I explain the 1,870 injections in regards to it?
What? No, that's all right. It shouldn't be a problem to make a diagnosis. Roni, let's go back to the office. Time to narrow down our possible candidates.
Understood, Doctor.
All right, so we got that as well.
So, we have all the symptoms. It's diagnosis time.
Okay, yeah, if it's already diagnosis time, then there's definitely a part 2.
Yeah. They wouldn't make it that easy. All right.
Mm-hmm. Pretty sure even
positive antibody reaction.
Yeah, I'm pretty sure even the first tutorial one was more complicated than that.
Yeah.
So it is Kaposi sarcoma. But why? The period of time until the onset is too short. It's similar to Kaposi sarcoma. This is something else.
Doctor, we have an urgent contact. Please head immediately to the examination. The patient has come to the hospital complaining of abdominal pains.
All right, I'm on my way.
Huh.
Abrupt stomach pain. What on earth is going on?
All right, so I guess question. We're at about 20-ish minutes
Mm-hmm.
right now, and we're at the second part. Do you want to just keep going in this episode?
Whatever you want to do. I'm okay with whatever.
Okay, because we could keep going, and if the second half ends up being a bit longer, then we could possibly avoid splitting it into more episodes.
Or do you mean if it ends up being a bit shorter?
Well, no, if it ends up being a bit longer. So instead of making it like stopping it here, and then the second half ends up being 2 episodes instead of 1.
Well, we'll see.
Okay.
Doctor,
See what
these may be
happens.
related to the tumors discovered before.
Great. Roni, you ready?
Yes, doctor. Commence diagnosis. when you are
Readmitted
ready.
for abdominal pain.
All right. Reserve an OR just in case. Let's begin.
Understood, doctor. I bid you good luck.
Phase 2. I don't think they ever go past phase 2. I don't think there are any like 3 phase.
Hey, are you all right? What's wrong?
Oh, well, I went to work, but my stomach started hurting all of a sudden.
There's a chance your condition took a turn for the worse. Roni, get ready for examination.
Yes, doctor. Begin when you are ready.
Alright, let's see what we have. So questioning and stethoscope.
My stomach suddenly started hurting.
Oh,
Hey, we got the heart back.
Yeah.
These are the sudden abdominal pains you mentioned earlier. Roni,
Yeah.
make a note of it.
Understood.
Thanks for pointing out the obvious.
Yep.
And I feel a little nauseous too.
Yep.
She's experiencing nausea as well. This is far from being good. Roni, make sure you're getting all this.
Understood, doctor.
I can't concentrate on my work with this going on. Please, doctor, see if there's anything wrong with me. I've told you everything I've been feeling. Let's see if there's anything else worth mentioning.
Yep, that is important.
Mm-hmm.
I see. Her abdomen is bloated then. Roni, add that to her record.
Understood, doctor. New symptom observed. Bloated abdomen.
Lately, I haven't been able to, I'm having trouble using the toilet fully. You understand?
Yes.
Trouble using the toilet fully? In other words, well, let's just be frank about it. It's nothing to be embarrassed about, right? We're animals. We excrete waste. Right. Well, I won't force you to say it then. But you're unable to produce those things on the toilet. Yes?
Yes.
Great. Now we're getting somewhere.
Understood, doctor.
Constipation.
New symptom observed. Constipation.
Oops, was that the end?
Don't know.
Now I have to check.
Yeah. That'll be quick.
And I can't, please, let's,
Oh, accidentally clicked on one.
Yeah.
oh,
Yeah,
that
okay, that
worked.
was the
Okay.
end. Wonder if there's something like, yeah. Okay.
Yeah.
Your intestines' bowel sounds are a bit violent.
Yeah, that,
I like how in the
that
last
is-
diagnosis you said that that's
write
almost
this down
never
too.
anything.
Well, because it's usually not.
New
Yeah.
symptom
Like usually when
observed.
you do the stethoscope, either it's a heart or a breathing problem.
Mm-hmm.
But I don't think there's a... Yeah. Like those are both fine.
Mm-hmm.
Well, and you see, in most of the cases where it's a
No,
heart
given
or
these symptoms,
lung
it
issue,
appears to be
it's
a problem with the
know,
intestines.
nothing with the bowels.
Roni,
Right.
get approval for an X-ray and a CT exam.
I've already sent in the request, doctor.
Good call. Maybe you should become a diagnostician.
With all due respect, Dr. Cunningham,
Yeah, I was just joking. Let's hurry up. Get going.
I do not understand what jokes are.
doctor, the results of the X-ray and CT examinations are ready for you to look over.
Well, I guess I should look them over.
Probably a good idea.
Yeah. Okay, yeah, there was a thing there.
fluid and gas in her intestine have completely separated.
Ew.
It's a NIVU, Roni, an air fluid level.
Understood, Doctor. New symptom observed. Formation of air fluid level.
I think that was the only thing on the X-ray. Yeah, that looks like it.
Yeah.
All right, this is gonna be fun. Also, in case you didn't see this over here, it shows you the level
Oh, yeah.
of the body that it's taken at. See anything on this one?
No, not really.
Actually, you know, it'd be useful if you want to move your pointer. You could actually show like what you're looking at. We could cover different areas, or we could just keep on. Oh, hello. Or you
I don't know
could
if that would really
continue
help
being
much.
lazy.
Atropine can be seen in
Yeah.
the left and right kidneys. Hey, Roni, would you call this a symptom?
Negative, Doctor. The patient has received a kidney transplant.
Ah, that's right. I forgot the new kidneys were transplanted without extracting the diseased ones.
Okay.
Well, that means this symptom's already been treated.
Correct, Doctor.
I guess you're right.
I'm sorry.
All right. Well,
Good-
at least we don't get penalized for it. All right. Looks like nothing on this scan then, aside
Yeah.
from those.
Right, that's what I think so.
Not seeing anything here either.
Yeah, I don't think I see anything either.
This is riveting.
Yeah.
I'm not seeing anything.
Yeah, so far I'm not either.
Doctor, the result.
Well, I guess I should look them
Well, we
over.
clearly missed something.
Oh, apparently we did. I mean, it's definitely not in the X-ray. Like, we can go over and look at this one, and there's nothing else. All right. So the question is where.
Every now and then you change the picture to the other one, and I think, oh wow, that's
Like, oh wow, that's exactly the same.
No, what I mean is,
Oh, you changed.
you change
between-
from like picture 1 to picture 2 instead of patient's picture to
Yeah,
reference
yeah.
picture. So if you do that,
You mean like
without-
this?
Yeah,
Yeah.
if you do that without me realizing that's what you're doing, it like whatever I'm looking at the moment, I'll be like, holy shit, that just. Oh wait.
Yeah. I'm not seeing anything. I imagine this is very exciting to watch.
Oh, I'm sure.
Welcome to being a doctor.
Or more accurately, pretending that you're totally a doctor.
Yeah. Do you see something? Because I don't see anything.
No, I don't see anything. Maybe we should see if it'll let us get into the diagnostic thing to
Well,
see if we can get an idea of what to look for.
I mean,
if there,
yeah, but
remember in the last one we figured out that kidney was enlarged because it said to look for an enlarged kidney. Things like that might help.
oh, hello. We also have these.
Yeah.
All right. A condition in which the contents of the intestine have been obstructed by the motor paralysis of the intestinal tube. All right. So, stomach pain, nausea, constipation, abdominal bloating, a lack of bowel sounds. So that's definitely not. It's definitely not this one.
Yeah.
Occlusive ileus. Condition in which the intestinal tube narrows or becomes blocked, obstructing the intestine, such as stomach pain, abdominal bloating, constipation, nausea, aggravated bowel sounds, air fluid level. Tumor shadows of the blockage will appear on a CT scan. So
Okay.
we're looking for dark marks in this case.
Yeah.
Also, that's the only one that we need to.
Oh. So that's probably. Well,
All
not
right, a condition
necessarily
in which the
probably.
liver cells cause acute inflammation due to multiplication of hepatitis viruses, complain of dull stomach pain, nausea. We didn't have any loss of appetite. Also, it's kind of like freaking out. I think if I'm trying to move the slider while it's doing something, yeah, I doubt it's hepatitis. Well, hepatitis is a liver condition too. So I highly doubt that it's this.
Yeah.
And we don't even have all
Yeah.
of that stuff yet. Inflammation of the liver. So yeah, I highly doubt it's
Yeah,
hepatitis.
probably.
Nausea.
I mean, there is a fever, but that's not relevant apparently. Like
Yeah,
from
this
last
looks
time.
like this is another liver,
Yeah.
and I highly doubt it's that. So
Yeah. So I think we have to look for the
the
tumor shadows.
tumor shadows on the CT scan.
Okay. So we know what it is, and we know what we need to look for. We just have to find it.
Pretty much. Yeah, we can't just say, well, we're
Yeah.
pretty sure it's this one. See, those look exactly the same. Like, there's no.
Yeah. I wish that it swapped between them as quickly as it swapped between edition.
Yeah, you could just like
Same
go
images.
in between. Yeah, because it's kind of annoying because you're looking for things and then it changes for just long enough that you're like, was something
Yeah.
there? Oh boy. If we don't find it, should we cut out maybe?
That would probably be a good idea if we don't find it soon. Oh, he switched back. Oh, no, never mind.
I swear we're gonna say like, oh, we're gonna cut out and then we'll find it like right away.
Yeah.
All right.
I think we'll plan to cut some of this out, and on the off chance
So-
it happens sooner, then you might hear this.
We'll see you when we find it. And that's a when, not an if. We're gonna find it.
Yep.
It might help you use your pointer.
I feel like that would just result in blocking more of the screen.
Oh my. Yeah. Yeah. Yes. I found it.
Dang it! I was away from my microphone
Shadows
because
of
I wasn't
small
expecting to
intestine.
find it. Well, that was about 30 seconds.
Hit that.
So there's a good chance that you saw that whole thing.
Probably.
Doctor, I do not have any opinions. My answers are based on statistics.
Whatever. Just spill it.
I'm currently collating this data with tumor examples in my archives.
Sure. Last time I asked a machine for a quick answer.
My calculations show there is an approximately 92% chance that these are tumors.
Whoa. Anyways, yeah, so let's just call them tumors for now then.
Do that, doctor. There remains an 8% probability that they are not tumors.
Yeah, and that pretty much means they're tumors. Well, just record the symptoms for now.
Understood, doctor. New symptom observed.
All right. So we should have it then.
All right.
I think we have everything we need to make a diagnosis.
Really?
I agree, doctor.
Just drag it on. Don't bother finding it. Yep.
Boom.
All right.
Second one was actually a lot faster than I was
Intestinal
expecting it to be.
ileus originated
Yeah.
from tumors in the small intestine.
Due to the location, there is probability that the primary focus will be the ones on the skin.
Damn it. I know.
Doctor, I would recommend that you examine the other organs as
Oh,
well.
wait, what?
Yeah, I agree. Let's
Well,
go
I
in.
guess
Is
maybe
this
you
a
were wrong.
three-part one?
I guess maybe you were wrong about it not going on to part 3.
Maybe I was.
Metastasis spreading from
Oh,
skin
yep.
tumors to the
Okay.
small intestine.
So, we'll see you next time.
Yeah, okay, bye.
I've been redxparasite.
I've been Air327.
Phase 3. Next time.